Welcome to Pennsylvania in Focus. I'm Kristen Smith. Joining me today is the Center Square's Pennsylvania reporter, Christina Lingell. Christina, earlier this week, you delved into a new report that considers what some might call an opioid tax, and that is measuring the amount of money that state and federal government spends on treating the opioid epidemic in this country. Tell us more about where Pennsylvania stands in this and how much money we're talking about.
So Pennsylvania stands it's not in the best position when it comes to opioid statistics. We are one of the highest states in the nation in terms of per capita opioid use disorder. And that comes in at over 2.5% per capita. So it's a significant number of people who are struggling with opioid use disorder. And then the average cost in Pennsylvania is significantly higher than the national average as well. So nationally, the annual cost, and this isn't just for the government or for healthcare, this is the total cost in terms of earnings lost for businesses, medical care, all kinds of things that come along, the judicial system, the burdens associated with that. The total cost for just having opioid use disorder for annually is close to $700,000. It's $695,000 in nationally. But within that, so we might think about it and be like, that's like a huge burden to the state. And certainly it is a lot coming from the federal and state government, but actually 532,000 of that 695,000 is a burden borne by the patient themselves. So it's a huge expense for individuals and for families, in addition to the societal cost. In Pennsylvania, it's actually $728,000 per person. So it's, tens of thousands of dollars more than the national average.
I think when we think about the opioid epidemic, I know back in 2016 is when former Governor Tom Wolf actually declared it a public health crisis here in Pennsylvania. But really, this issue stems back much farther than that, right?
Yeah. So the first wave, I guess, of the opioid crisis started in the 1990s. And that started with the overprescription of drugs like hydrocodone and morphine. And that's really, I think, the role that we see the drug companies that have been held accountable through civil suits. That's what really took off in the 90s was this prescription opioid problem. Then there's actually just like a very brief window in like 2010s, the teens, where heroin was a huge problem, and that very quickly gave way to the current crisis that we see with fentanyl. So what kind of started with overprescription for pain medication and that sort of flooding the market through a pharmaceutical channel turned into a really detrimental street trade of fentanyl. And as we know, like we're seeing fentanyl in all kinds of things, not just opiate. So it shows up in cocaine, it shows up in methamphetamine, it shows up in everything. So that's kind of the opioid crisis has kind of become a larger umbrella that really compounds other drug problems across the state and country.
There has been some accountability from pharmaceutical companies, right, in the form of financial compensation?
Yeah, so the state does have an opioid trust fund that they use or hope to use on projects that would help address the opioid crisis. We have done some reporting over the years that, it's been a little bit slower to come to fruition, but a lot of the programs that have been funded are definitely aiming towards, changing the approach to opioid use disorder and specifically using more medication-assisted treatment, which the study from Avalere showed a really significant cost reduction for all 4 types of therapy that they studied. They looked at just behavioral therapy alone, which had a cost reduction of $144,000, which is pretty significant considering that's just talking to people and, working with them one-to-one or in a peer group to sort of change those behaviors. Once you added in medication, that ranged from like $270,000 to $295,000 reduction in cost per year. So those include methadone and buprenorphine or naltrexone.
There was also something in your reporting about how different demographics are impacted by this crisis.
Yes, it's pretty interesting to look at the disparity because you find within white opioid use disorder cases, there are a lot of people who were prescribed opioids for pain management or to deal with a medical problem. And that can be kind of where that begins. Whereas within youth populations, it's more significant in populations that have more people of color. So it's an interesting, like there's different ways that people sort of come into first contact with these drugs. Black populations do tend to be more negatively affected in terms of the criminal justice system when it comes to these drugs. So one of the things that the report comments on is the idea that there should be some destigmatization and more accessibility to the kind of treatment that people need. Because right now it's still so bound up with the criminal justice system that a lot of times regular PCPs aren't really prepared to deal with it, or they themselves might still have some stigma around it and don't necessarily know how to approach treatment. Also, specifically methadone clinics, which they require you to show up every day and take methadone. So you have to be somewhere where you can access a methadone clinic every day in order to stay on track with your recovery. So that's something that like access is a huge barrier. Especially as we've talked extensively about our rural healthcare issues, being able to get the medicine where people need it is a huge obstacle.
All right, Christina, thanks for joining us today. To keep up with this story and more, follow us at thecentersquare.com/Pennsylvania.